And Dr. Rick Bright says in a statement to ABC News, sidelining me in the middle of this pandemic and placing politics and cronyism ahead of science puts lives at risk and stunts national efforts to safely and effectively address this urgent political health crisis. Joining us now, epidemiologist and Harvard public health scientist, Dr. Feigl-Ding. Thanks so much for joining us. How significant is this, Doctor? I mean, what role does the agency, Dr. Bright, how has he played a significant role in trying to find a vaccine?
Right. So he's in charge of BARDA, which this agency allocates funding from Congress into which priority treatments and randomized trial the U.S. government should fund. He's a Deputy Assistant Secretary, if I understand correctly, as well. So to oust someone of that level and he is not a political appointee, he is a career person, so no Senate confirmation. He's a career scientist and he spent that time. And to oust him for basically putting science first above political agenda is woefully wrong.
And new analysis found a higher rate of death among patients who used the malaria drug than those who did not. Is there consensus on just how safe this drug is to use?
There's no consensus until a randomized trial. But the study out today was not yesterday was not a trial, but is much better than an anecdotal case report. And previously, all we mostly had were anecdotal case reports. And that one yesterday was a mining of data set of tons of VA administration patients. And that data is actually an observational study, but is from mining a huge, large data set and be adjusted for wide variety of factors. So it is as good as evidence that we have until we have the trials ready.
And let's talk about what we know now about COVID-19 and possible treatments. I mean, remind us all of what we know as far as where we stand with treatments so far and how far we still have to go in order to find a possible treatment or vaccine that works.
Yeah, in terms of finding treatments that work, we really need trials. And trials obviously take time. Some drugs are in phase 1 for safety, but many drugs are in phase 2, which we're trying to test. Does it work? Remdesivir, there's tons of remdesivir drug trials. There's many other drug trials that I won't mention at the moment, but they are pipeline, and we will get results on them within the next 2, 3, 4 months as they finish. So I know people are very eagerly waiting, but the trials that will prove whether something works or not are just around the corner. And it's much better to be safe than sorry. And this is what Dr. Bright has been trying to advocate. No, go into safe drugs and prove that they're safe before you give them out in mass.
And lastly, while we have you, of course, it's getting closer to warm weather for much of the country. What do we know right now about the spread of this virus in warmer conditions? And explain also the concerns that we've been hearing about concerning a second potential deadly wave.
Yeah. A lot of people are hopeful that warm weather will reduce the incidence. There's a chance it might, but we have to realize in Australia and New Zealand, Australia especially, they had an early epidemic in the middle of their summer. And Singapore, they also had an epidemic right now as we speak and as they're exiting summer. So temperature is not a panacea, it's not guaranteed, because this is a virus of indoors, and most businesses that people would go to are indoors. As for the second resurgence, I definitely think that in the fall or next winter, there will be definitely a resurgence. Because by then we will not have a vaccine ready yet for mass use, but we will have drugs by the fall. So that is what hopefully there's resurgence. The second wave is not as bad as the first wave right now.
All right, and good news, I guess, if we can look at it that way, that at least we'll have some drugs by the time of a potential second wave. Dr. Feigl-Ding, thank you so much for joining us again tonight.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.